Let's say you fall, get injured, and have to spend months in a treatment with no way to communicate. That's what happened to Katharina Heckley as she was recovering from surgery in a skilled nursing and rehabilitation facility. Tonight, she shares how her rights were violated.
I literally was just going out to feed the cats. And that's when it all happened.
In 2018, Katharina Heckley was getting ready for bed and went to feed her cats when she suddenly fell down the stairs.
My hands didn't work. I could barely even see what was happening. I couldn't communicate at all. I lost all ability to control my hands.
Katharina, who was born deaf, uses her hands to speak. After falling, she laid on the ground until her family found her the next morning. She was rushed to the hospital and into surgery after suffering a brain bleed.
I went numb. I was in shock. I had muscle weakness on my right side as a result of that, both in my arm and my leg.
After surgery, Katharina needed an IV treatment for an infection. Instead of going home, she was transferred to Capital Transitional Care, a skilled nursing and rehabilitation center in South Sacramento. She says she immediately saw red flags.
There was no sign that even indicated that I was a deaf patient to anybody there. It literally left me without a voice. They called me deaf mute. It was the most impressive environment I had been in. I wanted to say to everybody, hi, I'm a human being. I'm just like you.
Katharina stayed at Capital Transitional Care for 3 months. She says she repeatedly asked for an American Sign Language interpreter, but the facility never provided one.
For 24 hours a day, I'm robbed of my ability to communicate. I felt like I was in a dungeon. It felt like I was in prison.
The highlight of her stay is when her family came to visit. She remembers staff trying to communicate by writing on paper. But because of her injury, there were times she couldn't write at all.
There were moments where I refused medication because people didn't describe to me what these medications were being used for.
Months later, with the help of her family and NorCal Services, a Sacramento nonprofit who helped the deaf and hard of hearing, Katharina filed a complaint against Capital Transitional Care with the California Department of Public Health.
I'm just now starting to develop some really emotional awareness about it. And I was going to say I'm angry, but quite frankly, I just feel like they should know better.
It wouldn't be until 2022 when the California Department of Public Health found the facility violated Katharina's rights to communicate, saying the residents' communication needs in American Sign Language services were not provided timely and put Katharina at a higher risk for unmet care needs.
When they gave me medication, they never explained to me what it was for. They robbed me of my ability to communicate the entire time I was there.
The state's investigation showed an ASL interpreter was only provided once to Katharina, 3 days before she was discharged. During that time, Katharina raised concerns to the facility about the need for more services for people who are deaf.
I was trying to show them that they have this service available for people who speak other languages. And that's what ASL is to me. It's my language.
Under California code, if a language barrier exists between a skilled nursing facility and patients, then arrangements should be made for interpreters to ensure adequate communication. The right to a sign language interpreter is also protected by the Americans with Disabilities Act. Under the law, healthcare providers are required to have qualified interpreters available for people who are deaf or hard of hearing. We reached out to Covenant Care, who owned and operated Capital Transitional Care in 2019. State data shows they averaged higher than normal complaints. In 2021, the statewide average of complaints received was 45. Capital Transitional Care received 103. Covenant Care tells us in part, Covenant Care takes the Americans with Disabilities Act seriously. At all times, Covenant Care strives to follow all federal, state, and local health and safety regulations and guidelines in providing a high level of care for its residents. They added, we welcome all persons with any disability and are heartily sorry that anyone has ever felt they suffered a rights violation anywhere for any reason. As for why Katharina is sharing her story with us,
I want the deaf community to have access to communication. We face barriers all the time. It's time to resolve these barriers. It's time to do something about this. We're human just like everybody else. We have a right to communication. We have a right to interpreters.
And we want to mention that Capital Transitional Care changed ownership starting in April of 2023. The facility is now under new ownership and has been renamed Capital Post-Acute. Now, if you or a loved one are in a long-term care facility and have concerns about quality of care, rights violations, and other issues related to health and safety, then you can contact a long-term care ombudsman office to ensure your facility is providing adequate care. So you can also call the statewide crisis line number, which is 1-800-231-4024. That crisis line is available 24 hours a day, 7 days a week to take calls and refer complaints from residents in long-term care facilities. And we do have all this information up right now on our website.